So far I've met people from the local traveller visibility group, their primary healthcare workers mainly, and also other traveller groups on the north side and south side of the city. That's led to fairly lively debates and conversations about planning for money matters. It turns out that the primary healthcare workers actually became like ambassadors for MABS, because they were the contact with their own peers, you know, in the traveller community. It's very important to make personal contact with traveller groups, and it promotes a huge awareness of our services, and we learn from each other. We become aware of their culture and they become aware of what service we offer.
As part of our work, we do a lot of outreach weekly, and we would have come across people who would be struggling financially or finding it hard to cope if there was occasions coming up, Holy Communions, Christmas, and I suppose just to pass on that information to them, that there was help and support there for them, was great.
For like the caravan, you can compare it to a pay-as-you-go credit, like.
Yeah.
You had what you had and you spent what you had, and that's what you might do with.
The tips and the points that they give, I was thinking, well, I will give them to my younger generation in the future and tell them and stuff about MABS, but I would have liked to know about MABS when I came from a caravan into a house, because it would have been very, very hard for me, because I would have lived in a halting site, and we would have, any money we had, we would have spent it in the week in the garage or getting coal and going to the local shop or whatever. And then when it came this big move, step into the house, and you weren't getting your bills once a month, once every 2 months, and it was very nerve-wracking, because sometimes when you have kids and they want stuff and you've got an extra few pound in your pocket, you think tomorrow's never going to come, and you give it out.
Like, some people are very good at going in and saying, look, I'm sorry, I've lost my job, or I've less money now and I can't keep paying you, say, 30 a week I was, but I can pay you 15 or 20. And they'd be quite confident going in and doing that. But I'd say they're in the minority.
And travellers are very proud as well. They wouldn't let travellers know if they're in financial bother.
Sure. The same as a second person wouldn't.
That's it. So,
you know?
like, even though
we reassure people, whatever their situation is, whatever it be, that it's just between them and the person they meet in MABS. They don't even have to tell us their private situation or what's going on. People might give you a bullet point of their situation, but you know there's probably a mile behind it that they don't want to come out with, so then they'd feel more comfortable. And you'd always tell them that, like, when you go, you're just meeting a person who'd be very welcome, you'll have a cup of tea, and they'll help support you the best way they can.
I think that MABS is a great service, and that it is there to help. And if you are in financially difficulty, that to contact MABS, and they will try to support you the best way they can.
If I were to recommend 3 small changes to my MABS colleagues, I would say, number 1, make contact with local traveller communities, and then let travellers know that they can make contact directly or through their own primary healthcare workers. Number 2, emphasise MABS's independence and confidentiality to traveller clients. Third is to keep sowing the seeds through community education and promotion of the services that MABS offers.